This week we will read about the infection. This chapter helps lay down the foundation for why we need to build and strengthen our resiliency skills. So this video will discuss the impact of being exposed to work-related stress and traumatic stress in different ways and in different helping professions, as well as how long-term exposure can lead to things like burnout. So before we go further, take a moment and think about how you would finish this phrase. Knowledge is. You may have answered knowledge is power, or some of you might have thought knowledge is potential power. If you chose this as your answer, then you are correct. Knowledge is potential power. That's right. We often hear this phrase as knowledge is power, as it is a common phrase in our society. However, knowledge can only be powerful if we use it. For example, many of us know that exercising, eating well, and getting enough sleep are important to our physical and mental health, right? However, many of us fail to exercise enough, eat enough fruits and veggies, or get enough sleep every night. So therefore, we can agree that knowledge is potential power. It becomes powerful when we apply the knowledge that we've learned. With that being said, a lot of what we learn in our course can only empower us if we choose to apply it. So, what types of stressors are common in your line of work or your potential line of work? Think about the physical, psychological, and emotional stressors that you experience or anticipate experiencing in your future work. Some stressors that you are thinking of might include lower pay, expectations of high work performance, meeting challenging deadlines, being treated unfairly by your coworker or supervisors, possibly having heavier workloads. This can be related due to funding and things like that. So there are many, many stressors. These stressors go on that we can experience or are experiencing in our line of work. The one thing that we know is that stressors will be there. We can't control that. What we can control is how we respond to those stressors that confront us in our day-to-day work and our day-to-day life, which is basically what we are going to discuss throughout this course and later on in this video. But before we do that, let's examine some work-related stress in a little bit more detail. So work-related stress, like the ones we listed a few moments ago, have physical and mental impacts on us. In fact, statistics show that people who feel like they have been treated unfairly increase their risk for things like coronary heart disease. Stressors like these can also cause high blood pressure issues, which has a negative impact on our physical and our mental health. And furthermore, chronic states of poor health can lead to devastating consequences later on in life or throughout one's life. So these things can include things like heart attacks, strokes, aneurysms, heart failure, vision loss, diabetes, and the list goes on. So in addition to the impact of everyday work-related stress, some professionals are also exposed to high levels of traumatic stress. So while work-related stressors and life stressors absolutely can disrupt life, they tend to have a less severe impact on our physical and mental health, unless of course they're chronic, which we'll talk about in more detail in another video. But in addition to these stressors, traumatic stress aggravates these stressors even more. So you can see here on this slide that the general public experiences traumatic stress, but at much lower rates than our professionals who are working as frontline workers and our first responders. So in fact, police officers are known to experience 3 traumatic stressors every 6 months on the job, which that's very extensive. So because that's 6 traumatic events a year. So multiply that by years of service, and it's absolutely a significant amount of traumatic events that are experienced in one's lifetime. So we know that some professions will be exposed to traumatic events and traumatic stress at much higher rates than other professions will be. And there are consequences for that. So here are the consequences for specifically untreated traumatic stress. PTSD, alcohol abuse as a coping mechanism, higher rates of depression, suicide, which we're going to touch on in a little bit as well, sleep problems, hypertension, relationship issues. Yeah, these spill into our relationships and can negatively impact our ability to connect with the ones we love the most. And of course, that list continues to grow and go on and on. In addition to that, burnout is another consequence. So burnout is especially high in the helping professions, like with first responders, our counselors, mental health workers, our medical professionals. So burnout is something that they experience at higher rates than other professions. So firefighters, EMTs, paramedics, law enforcement experience elevated levels of burnout, like I mentioned, and have higher rates of emotional exhaustion, depersonalization as a result of those traumatic events that they experience, and increased risk of alcohol and drug use. Physicians are also at high risk. 54% of doctors report being burnt out. 88% report being moderately to severely stressed, and 59% would not recommend a career in medicine for their children. So these numbers are likely increased have likely increased during the global pandemic, and will have lasting effects as a result. So other helping professions also report high levels of burnout. According to our textbook, 82% of emergency nurses reported moderate to high levels of burnout. And there's many studies that support this too across the nursing profession. 40% of nurses working in assisted living facilities reported experienced symptoms of burnout. And of course, our mental health professionals also experience symptoms of burnout as a result of the work that they do, helping others heal from past traumas and the stressors in their lives. What makes this even more serious are the death by suicide rates. According to our text, about 300 physicians die by suicide each year. In addition, in 2018, 541 deaths among our active military and reserves were reported. And in 2017, 103 firefighters died. And in 2019, 228 police officers. These numbers are alarming, and we need to do more to support our frontline workers who are suffering from the traumas they experience as a result of protecting our community. So if you or anyone you know are thinking about suicide, talk to a mental health professional. Here's the National Suicide Hotline number. It's 1-800-273-TALK. And of course, we do have a counseling department on campus where you can schedule an appointment to meet with a counselor as well for support. You can reach our counselors at 623-845-3064 to schedule an appointment, or by emailing counseling@gccaz.edu. So what can be done to prevent burnout and other physical and mental health issues like we've talked about today? We're going to spend a good part of our time in this course finding hope by learning things like self-regulation skills, mental flexibility, or looking at situations differently, building positive psychological strengths, enhancing social regulation skills, practicing mindfulness and building self-motivation, and then of course practicing self-care regularly. And that's a key word for the work that we're talking about in our course. It requires us to be intentional, and it requires us to practice it regularly for it to be effective. So to end this session, I'd like to share a quote that was written by the author of the textbook, Dr. Aubrey. And it reads, "We can mistakenly think that mental health is about treating mental illness, but that's only half-baked. Mental health is also about building good mental and emotional health. It's about practicing mental health self-care and enhancing well-being." So I'll leave you with that quote. Take care and make it a great week.